Hi, I'm Dr. Dipali Bharadwaj and today here with you for a very interesting topic on exclusively the print. Menopause and skin changes. Well, 25 million women every year are undergoing menopause, and it's not just the woman who undergoes menopause, it's also the whole society, it's the family which is affected. With menopause, elastin degradation and collagen degradation is so fast that 1/3 of the body's collagen is lost in the first 5 years of menopause. Menopause generally starts at the age of 40 for women and goes on and ends by the age of 50. So imagine the hormone changes in a woman, the irritability and the skin changes and the systemic changes. For the inside out systemic changes, the first and the primary line of therapy is always going to be hormone replacement therapy for menopause. But yes, we must know that HRT comes along with its series of side effects. So one needs to balance and weigh out the pros and cons and then go on for HRT if needed. Let's discuss the skin changes for menopausal women. And I'm sure all of us, if haven't yet menopaused, are going to go get there. So most importantly, in menopausal ladies, we see dryness, we see flushing, we see sensitive skin, we see rosacea, we see acne, we see more hair increase, the hirsutism, we see hair fall, and besides that, of course, dull and dry skin. So it's a lot of things to battle with, along with the hormonal changes which is happening inside a woman who's always had high estrogen levels. Well, to understand how to combat these skin changes as a dermatologist, over the years, what I've learned is you need to work inside out. Don't just think that applying moisturizers or applying lotions is going to take care of the dryness. You need to regularly check your blood tests because you could also be a patient of hypothyroidism, reduced thyroid levels, which is very common in Indian women. It's like an epidemic, not just women, even in men now with age. I'm seeing the change in last 5 years. So yes, checking on your hypothyroidism if you're having excessive dry skin is a good idea. Well, diet plays an important role, and we know B6, B7, B3, B9, B12. We need lots of it. We need high omega-rich diets. You need to fight the pruritus, the irritation, the allergy, the dry skin, the eczema flares, the psoriasis flare which happens during menopause. That's only going to happen not just by applying topical steroids, visiting dermatologists, doing treatments, also inside-out diet. And if you start it early, if you ensure that you started by 40, I'm sure you're going to see the benefit even at 50. Increase olive oil in your diet. That's also going to increase the emollient levels in your body from inside. Always use emollients with lower pH. Yes, lesser paraffin, lesser chemical, lesser perfume in it. And lower pH is always going to help you. Do not use exfoliations on your body. That's going to increase the dryness post-menopause. Never do that, especially if you're having any itching. Try and keep your nails short, especially if you suffer during menopause with dryness and irritation, so that in night also you don't land up itching and you don't have to visit a dermatologist. Try and use a humidifier. Yes, a simple humidifier can also help increase the water levels, the hydration levels, the oxygen levels, the skin quality, because we are losing our elastin and collagen and the hydration capacity with age during menopause. Go ahead, and it's a good idea to do some therapy for your own self. Do some deep breathing, do some relaxation exercises if you're suffering from flushing and rosacea, besides the dermatology treatments where you can use metronidazole gels and do photofacials and IPL kind of treatments for the rosacea, which is also going to help you tremendously. There is a very interesting society, and it's called the Indian Menopausal Society, where a lot of women are registered, and you can actually seek help and take some counseling and help yourself and learn these kind of exercises. And many of these things are very much free and being provided for the common people. So I think it's a great idea for women who are undergoing menopause to register over there. So enjoy the womanhood, enjoy your diet along with it. Make sure it's high omega, I would repeat, and high flax seeds and avocado and some olive oil. Enjoy every phase of womanhood. That's what I do. It's all about beauty and life. That's what woman is all about. So yes, please stay tuned with us on exclusive